This video is disseminated on behalf of Rocket Doctor AI.
I'm a family doctor over 25 years, and one of the things I've been doing since I was before even 18 years old has been investing. And so I really dig deep into companies. When I invest, I do very deep due diligence. I often sign NDAs. I talk to management. I look at the technology, if it's a technology company. So my first company I took public was called CloudMD. Took it from under 10 million in market cap to north of 700 million market cap, and revenues of less than 3 million to I think close to 200 million near the top. And we're able to kind of grow it very quickly. But I left it about 4 years ago because I love building companies, and this company became very, very big to the point where we had over 500 employees across North America. And it became something where I was just managing lawyers and accountants and not what I like to do, which is the technology and the growth aspect of the company. I left about 4 years ago, took a bit of time off, and then I was going to approach treatment as an investment. And this was going to be my first big investment since I left. And so when I signed the NDA and looked at the technology, I was blown away. As a doctor and understanding the space, I'm blown away by how powerful it is. And I know the space because we were looking for solutions like this when I was at CloudMD, trying to find something that integrated into our comprehensive ecosystem that we were trying to create. And I couldn't find anything like it. And so I loved the technology. I did not like, obviously, the business itself, the way it was managed at that time. And so I decided to come in as a CEO. And the first person I called, obviously, was Richard to come in as a COO. And we spent the last year and a half getting to this point where it's at the inflection point of commercialization and revenues and contracts. And as you know, we bought our first company in Rocket Doctor here. But the thing that really drew me is really how powerful this technology is and how dramatic it can transform healthcare delivery for what I call the 3 Ps: the patient, the provider, whether it's a doctor, nurse, whoever it is, specialist, and the payer. And so when you have the buy-in of kind of all 3 levels of healthcare, you have a slam dunk type of solution if you can get the adoption of it.
So my background's in emergency medicine and family practice, trained clinically across Canada. And then when I was finished my clinical training, went back to school to Hopkins to do a public health degree, and then spent some time at the NIH doing a fellowship, and then was teaching at University of Southern California for a bit, living in Los Angeles, and worked for Kaiser Permanente and was going from West Coast to East Coast and up to Toronto, where I was doing some ER, and then to East Africa. The reason for that is my first startup was about 15 years ago in the nonprofit space, a group called Bridge to Health, Medical and Dental. And through that, got involved in a high-tech diagnostics with cloud-based teleradiology and got some press on the cover of the New York Times in the spring of 2019. That pushed me more into the tech sector. And then working domestically in the emergency department, just seeing a ton of patients coming to the hospital with outpatient primary care issues that really didn't need to be there. Was thinking if we could combine, high-tech diagnostics, virtual care, we could really improve the system. So that was fall 2019. And then when the pandemic hit in the spring of 2020, dove in headfirst and launched Rocket Doctor. And we very quickly scaled the company, and from nothing now to about anywhere from 400 to 800 visits a day. We decided to partner with ESOM and treatment in this way because our goal was always to use technology to make healthcare better and more efficient, improve the lives of physicians as well as patients. And it was just kind of a natural synergy.
I've worked right from telecommunications through networking up into a whole range of applications. I've worked across most industries at some point in time, I think, and most of my roles have been global in nature. I came into healthcare about 17, 18 years ago, and I was then I came on to lead a team that was providing the clinical content and clinical decision support software. So you'll see some of the relevancy into the National Health Service in the UK. At that time, it was the largest national triage service globally. And then my remit, apart from looking after them, was to then take that globally. And that's what we did. We went to kind of Australasia, North America, so Canada and the US, Europe and Africa. And then having done that, I emigrated so I'm based in Vancouver in Canada. I emigrated here in 2014, and shortly after coming here and understanding some of the local scene, I joined a US digital healthcare company called Health Navigator. And I was with them for a few years up till 2019. And we were doing some really, this was the early days of chatbots and solutions like that, or health bots anyway. And we were, part of one of our clients, for instance, was Microsoft. They use our content within their own health bot at the time. And then we were acquired in 2019, so just pre-pandemic, by Amazon. So Amazon Care, if you remember at that time, were looking to kind of build out a solution primarily for their employees, but they literally bought our company lock, stock and barrel and took it off the market. And during that time, working with Health Navigator, I'd met Isam. They were actually a prospect of mine. And after Health Navigator was acquired, we carried on the conversation. And I ended up joining what was then the precursor to CloudMD at the back end of 2019. I think I was probably the fifth guy through the door. And I won't assume everything, but as you know, this was all pre-pandemic, and then the pandemic hit and we were in the virtual care space. So it was 7 days a week working. We had EMR solutions, billing solutions, and we made a whole number of acquisitions over the next 18 months to 2 years, and the company grew substantially. So I was part of that. And then having left there, I did some work with a few different companies, different industries outside of healthcare. And then Isam contacted me about 15, 16 months ago, I guess, saying that he had been involved with this company called Treatment. Was I interested? And having come from that, as I mentioned before, that clinical decision support background, I could see the kind of, the strengths and otherwise of the opportunity. And that's what drew me in. So I came in initially on contract and then joined permanently just over a year ago.